I'll do the introduction. So hi, everyone. My name's Meredith Merriman, and I'm today's moderator. So today we'll be talking to Dr. Raj Sundar from Kaiser, and I'll be monitoring during his presentation. I'll be monitoring the chat box and also monitoring the reaction. So if you want to raise your hand that way, you can to ask your question. If you feel brave enough, we welcome you to turn your camera on. If not, I get it, but please do if you want. And with that, I'll let Dr. Sundar take it away.
Thank you, Meredith. Yeah, I really wish there was more cameras. I just like seeing people's faces. Again, nobody can force you,
Hint,
but I
hint.
would love to hint. And somebody entered the waiting room too, Meredith. I kind of get these pop-ups. I don't know if I'm supposed to do anything, but just FYI. So I really actually want this session to be a lot of question and answer, because I feel like then I can really answer what's on your mind. But it's helpful to always start out with just explaining what I do and what this session's about. When I talked to Corey at the beginning, and she really wanted me to talk about just leadership, especially with health equity and in healthcare. And thinking about what I do now, like no way when I was in medical school or high school thought this was like a real position or this could be a job out there. And so much I feel like in high school is just knowing what's out there and what the possibilities are. When you think about going into healthcare, people often just think about like hospitals, right? But healthcare is so much bigger than that. If you're a clinician, if you're seeing patients, like not only is it hospital, but it's clinic, but it's like delivering babies. And I'll tell you, like doing vasectomies, all things that I like to do, but also there's a lot of things you need to do it with leadership, because it's actually a job of a lot of people, and you need to help people grow, coach, and figure out how to like serve our patients and our community the best you can. So I'll kind of just show you I think I want to just show you what my day looks like. And then that'll be like 5-10 minutes. And then let's just talk about what questions you have and what's on your mind, what's confusing, and whatever will be useful to you. So I know we all did the land acknowledgement already, but we do at Kaiser in our roles do the land acknowledgement, and I won't read all of this today. We kind of focus on Duwamish because we're just in the Seattle area often, although I know there's so many parts of Washington that we probably need to talk about, especially when we talk about the indigenous land. And just honoring everything that's going around you. I feel so like this is also important, because the hardest part of my day sometimes is when I show up to meetings and it's all day long about things that we're doing in the clinic or in our system, but we don't acknowledge what's happening in the world right now. And it's like so heavy, right? When we don't acknowledge that space. And I hope you all have that space in all your meetings and in the Sound Careers Healthcare Week. But I know for my API community and people I interacted with, just these times are hard, and solidarity and authentic allyship is really important. So just doing just a moment of silence, if we all can do that just for a second. And then of course, like, I'm from North Carolina, and I just heard about another police killing too, and I want to acknowledge that too, because things are so hard out there, and like we're always grieving, and that's really tough. Again, I just want to acknowledge that before we get started. And I try to do this in every meeting I'm in, and this is also to show you that it's important, like whatever leadership position you're in, and part of why we need people who look like you all, who I don't know because you don't have your camera on, but people who look in all kinds of ways up here, because there's not enough of you here who are acknowledging what's happening in the world. Okay, so objectives is pretty simple for me. It's like, we need you, you can do it, and we can help you. And hopefully that's what I want to help you get out of this presentation, even though it might seem daunting of all the things that I do. So this is my week, and I'll kind of go little by little because it's going to be just a lot to walk through. And I know compared to a school day, this seems really long, but I promise just because I work because I like to, and sometimes you just end up seeing patients longer. So this is Monday through Friday, and there's actually, I kind of do like 3 different jobs, which it's hard to imagine when you think about going to healthcare that people can do that. But that's like number one, I want you to know, right? That it looks different depending on where you are and which organization you are. So the easiest to understand is probably like Tuesday, Wednesday, and Friday. And what I do in those days is I come to clinic, which is here in Burien, and I see patients essentially from about 8 to 4:30. I kind of put in some travel time and to prep time and things like that to say that's what my day usually looks like when I get home. And in the clinic, I see people from all ages, right? From babies, I see newborns, all the way to, I think my oldest patient's 100 years old. So I kind of cover every year of life. And I also get to do procedures, which is what I mentioned before. And with family medicine, you just get to do everything and whatever you want, and you can even specialize in certain things. So for me, my specialty is Suboxones. So I provide Suboxone care for different people with substance use disorder. And the second is HIV specialist. So I have about, I think now like 50 or 60 patients who live with HIV who take care of. And I really like building those relationships. And so much of what I do is about relationships in this clinic. So that's easy to understand. So Thursday is my chief day. So what my chief day, what I mean by that is I actually lead this clinic too, meaning there are about 17 doctors slash physician assistants and nurse practitioners in this clinic, and I help lead them. So I'll tell you what that really means. And I also help run this clinic here in Burien. We take care of about 18,000 patients now. So trying to figure out how we can do that successfully, trying to be in part of a big organization. And then Monday is where I do my health equity and action team lead role, and I'll talk a little bit about that too. And then my weekend, I again, I do this because I like it, and I think my partner would say it worked too much, but I do end up still doing some deliveries because I actually do a lot of prenatal care. So I see everybody who's a lot of people who are pregnant, and I have at least 3 or 4 deliveries every month, which I go into Swedish hospitals. So what I mean when I say continuity deliveries, I take care of them through all their prenatal care until they need to give birth. And whenever they go into labor, I actually cancel everything I'm doing and go and deliver their baby. So it could be in clinic, or if it's a weekend, I have usually some backup if I really have to be somewhere else. And then nowadays I help do vaccine clinics. And then I do hospital swing shifts, which means I admit patients in the hospital. And then I will write too, and I'll tell you a little bit about that. Okay, leadership. I like to define it because people talk about it a lot, but it's really helpful to have a definition of it. And people define it so many different ways. I think this is a really helpful definition because for me at least, it helps encompass the community organizing part of it, and helps you realize that leadership can be really community centered. It doesn't have to be some white man in like a high position with ivory tower in the ivory tower trying to tell us what to do. Like it can be like a people-led way of leading, right? So what that means is like leadership is accepting the responsibility, right, to create conditions that enable others to achieve shared purpose in the face of uncertainty. So that's what leadership is, like things we don't know what the right way forward is. We sometimes know, but we kind of figure it out together, and we work together to have a shared purpose and somewhere we want to go towards. And when I talk about leadership, for me, when I do the health equity and action team lead, so what that is so I have an admin person that I work with too. But our goal with HEAT is to hold conversations, forums, and panels to bring people together, to change or modify strategies that's happening in Kaiser Permanente that's not feeling like it's really centering equity, or it really feels like something's not working well. So I'm going to use 2 examples because that kind of helps to explain what we do. Is like the first is like trying to say this problem with white supremacy is like when vaccination was starting out, like it seemed so obvious to people we got to vaccinate people, but then they didn't think about transportation issues, they didn't think about like how people would get places, and it really left a lot of people behind because we had 2 clinics in centralized places, and people who had technology, who could get on their phones, who understood English, got all those slots really quickly, and people who couldn't just didn't get it, right? Even if they wanted to, they would call, but the call line would be like 2 hours long, so they wouldn't get it. So it's this idea of like, if you don't acknowledge the inequities in the system, it just perpetuates our system of inequities and racism too, right? And disproportionately, certain people suffer more than others. So what at HEAT we really believe is that the bringing people together, like, we had a forum where I brought in the leaders of our organization together, but also brought in community voices. So I brought in the leader for the Asian Pacific Islander community, and also the health boards, if y'all are aware of that. There's a Somali health board, African American health board, so different health boards in the community, and some of the representatives from the African American health board came too. And my job really and is to just create a space in these forums which it's safe enough for people to feel uncomfortable but not shut down, and to really create a space where people listen. So we had this forum where I brought in community voices and patients and leaders to really make this point of how people are not getting vaccinated that need to be vaccinated. And it really was powerful because when you hear people speak, especially people who are closest to the ground or the community who understand what's going on, people tend to realize, no matter what their background is, where they're a level in the organization, that we need to do something differently. So after that forum, we were able to change our strategy a bit. And we knew that the thing with Kaiser is, and I can tell you honestly, I do love like working here, but it excludes so many people because you have to have Kaiser insurance to come here, right? And I think a lot of that makes it inequitable in itself, but we don't understand what happens to the community. So actually the best way for us to make sure things are equitable was give back the vaccines that we had to the community. And that's what we did. We worked with the community health worker program with King County and other places to actually give the vaccines back and just give what we had, which was space. Like if they really wanted space, we had that. So just working together in a more intentional way to make sure that didn't happen. And the second thing is about showing up authentically at work. And this is why I showed the slide before, right? Like all the API violence that's happening here, which was like nobody was talking about it for such a long time. And then there was these massacres that happened, and then all these stories came about. And Stop API Hate, if you don't know, that organization has been tracking these incidents for such a long time. And so many people in our organization, I really think about patients a lot, but there's actually a lot of employees who I work with who have been struggling with this for so long, and it's been really heavy on them too. And what does it mean to show up authentically to work with what you're experiencing and still get through your day and have a feeling that you're part of a community that's supporting you? So for that, we're working with, we say, a business resource group, which is just like 4 different groups to get together, like interest groups. But there's Asian Pacific Islander interest group, and we're just trying to figure out how we can hold listening sessions, but also make sure that it's not about listening, but also translate to action, meaning like really defining what does authentic allyship mean and solidarity. So it's not just about posting a hashtag or a selfie to say you're supportive, but like when people are actually suffering, when somebody's like making inappropriate jokes or being racist, that all allies, white, everybody are able to stand up to them, and trying to figure out how to do that. So that's just one of the most rewarding parts of my work. And really, like, I would have, even like 3 years ago, I didn't know something like this would exist in an organization. But I want you to know more and more there's opportunity like this because healthcare needs this. And healthcare needs like clinicians who can do this, right? Like people like me, but also you, if you go through med school and become a clinician or PA school, whatever healthcare field you go to, medical assistant, is like we need people who are providing healthcare to lead this kind of work in healthcare organization, because healthcare organizations need that a lot. So that's like my Monday work, right? So then my Thursday work this is like the very institutional part of my work where I sit in a very large hierarchy of a really big organization. This is just to show you like all the leadership who are all like physicians or clinicians in different extents, right? These are all the different leadership opportunities they have. For example, you look here, somebody leads the quality and safety, HR, service, wellness, graduate medical education, opioid safety and policy. So there's there's a lot of people, and again, I'll keep saying like we need more people who look different because you'll kind of see a recurring theme here, as always, in a lot of leadership, right? Um, and this is we keep going down the food chain. And so I'm not super high up, but I'm right there. You see me there. That's me. So I'm in this who I report to this person. Um, so I am the chief of our medical clinic, and we all work together to run all the different clinics in our region. So when I think about where do I lie, this is like in healthcare, just like with all levels of management, there's like different places you can be. Even as I say, it's like a clinician, right? Like there's somebody who's like leading on the ground, and all levels are important, right? Not saying like one is better than the other. And you don't need to aspire to get to the top level, because we need people who can do the work correctly and passionately at every level. And I'm probably like around here, right? I'm not in the CEO, CFO level, somewhere around here. And then I help manage a few people below me too. Um, so what does managing people look like as a clinician? I help people grow to be a good doctor or a better one. So make sure they are do like quality work, so they take care of their patients well. I mean, all of us could always keep learning and growing, and same thing for doctors. We're not, like you've probably had different healthcare interactions, and I'm sure you had some good ones and some bad ones. And I'm sure I've had some good moments and some bad moments, and it's important to acknowledge that and try to work together to see like where those gaps are and try to get people better, right? Whether that is like you're not doing a good job of like making sure you talk about all the colon cancer screening and breast cancer screening, because that's really important to save lives, and you're just trying to get through the day. Or like thinking about anti-racism, like your implicit bias, like why do certain of your patients aren't getting the care they deserve, and like what is it that you're doing that's affecting that. So quality is that, and then also efficient, because my goal here again is to make you believe that you can do this, is like being more efficient, because healthcare is also is about the people that are providing the care. And there's a lot of burnout here, right? Like you hear people talk about that, people who are like frustrated and like just it's hard being a doctor, but there are ways to be more efficient and still be true to yourself and the care you provide. So try to help people be more efficient. And I mean, this is something I'm working on. I just became the chief, and for me, it's like learning how to coach people, how to get people to that level, and really make them care, like get them to a place where they feel well and not so burnt out, because they also have families they want to get to, and they have kids and all the things they care about. And then the second is helping to make sure the clinic runs well. So that is like all the nuances of like what should we do with the COVID precautions? Like how many feet should people be standing, and what should we do in the clinic to celebrate like we did really well on something? So there's all these little decisions we have to make, and I consult our different managers, because it's not just me. So I have 17 doctors that are clinicians that I help manage, but then there's like 17 medical assistants, and there's 4 nurses and 5 people in the front desk. So there's a manager here and a person who does clinical admin that I work together with and to help make sure things run okay. So being a doctor, this is the first I started out with. This is kind of what my schedule looks like. As you can see, kind of have a 2-year-old at the beginning. I think this is my Friday schedule. And then I have the OB, so the prenatal care that I do. And then I think I have something with trans care, and then this is the opioid care. So it's kind of just a lot of different things that I do, and always better when I know the patients that I take care of. Oops, sorry, their names are on there. I'm going to go through this quickly. Um, so the last part of it is writing. So I write just when I have instances that I feel like the broader community should hear. And you have to be careful about writing, because you don't want to be extractive or voyeuristic in that using people's stories without their permission. And I feel like when you become a clinician, I'll say that you have the power to do that, and you have to be careful about it. So I often get permission of people that I write about, but I also write about just my experiences. And really, for my recent articles, was just trying to highlight how people were left behind with virtual care. That was a huge thing that happened at the beginning of the pandemic. That was with the medical journal. And then I did some with the journalism about just how I was getting a little burnt out because people were coming back and there was just so much things that we needed to do. And then marching in a pandemic. So there's this, you also have this voice as a clinician. So all my point is not to say that I write and I'm cool or something, but like you get this voice as a healthcare professional. And with that, just because you are, like, it doesn't mean you're right or it doesn't mean you're smart. It's just because you're a clinician, you take care of patients, people like listen to you in the community. Like it could be in local government, but also could be writing because people really trust you because you're taking care of people. And you really do get to listen to so many people's stories one-on-one that so many people actually don't know. And you get to like be a holder of those stories. And I think some of them are worth amplifying so the world around them knows what's happening and trying to improve the systems of care that we're in. And also like people around us who are trying to make healthcare better because we know the healthcare system in our country is broken and we've only marginally improved it. And we can talk, like, it's a whole different conversation, obviously. But that's just to say that you also have this voice that you can use in so many different ways, writing, government, voting, just in the community in whatever way you want. So we, oh,
Doctor,
yeah,
sorry, doctor. I just want
yeah,
to give you a heads up. We have about 7 minutes left.
okay, thank you so much.
You're
So
welcome.
I'm done, actually. We need you. You can do it. We can help you. Okay, I'm done.
Does anyone have any questions regarding the doctor's day, about what he does, and anything? I mean, it's very rare you have a chance to ask a doctor all your questions. Take advantage.
Yeah, and you can really, I'm really open. You can all contact me later too. I don't know if they give you my contact info, but you can if you have questions later.
Non-medical.
Yeah, non-medical. Don't send me pictures of your rash or something. I don't know if that's okay.
So Sarah thought everything you showed was cool. Does anyone else have any questions? Doctor, how did you start getting into, because I know, you go to school for family medicine or for whatever specialty.
Yeah.
How did that shape, or has your career shaped what you're doing now? Or how did that kind of, because when I hear doctors, I just think
Yeah.
of, I'm in the clinic all day, that's it.
Sorry, I'm supposed to, 1 second. Okay. I know. So I think that's also something that I didn't know, right? You think of doctors are just seeing patients all day long, but even after, so I think most people, everybody's here is in high school. So you'll go to college, and even in college, like I thought you were supposed to take all this healthcare stuff to get prepared for med school, but what I realized quickly is you just need to take the minimum because a lot of things that you do and a lot of courses you do in college, you're going to forget. And that's just the truth. And like, you're going to learn everything important in medical school. So, but you do the minimum, which is going to be like chemistry, biology, all that stuff, but you don't need to like major in biology or major in chemistry. And actually, people want to see different ways of thinking. So I actually majored in business just because I thought it was interesting in college. And then I applied to medical school. Not saying you need to, again, I don't want to say that you have to major in business to do all this stuff because I don't think people really care that I do in business. And I'm going to reiterate the point that you don't remember a lot of courses that you take in college. But I think just the point that you can do a lot of different things in college. And then in medical school, you just get a lot of opportunities to lead your colleagues, whether that's in your medical school class or something like that. And then once you actually become a doctor, if you're in an organization, especially like Kaiser, there's just so many opportunities just for leadership, and they just need more and more people leading. And then they also support you to build that leadership skills, whether that's like courses or like mentorship within the institution. So just like I want to be mentors for people in high school or college, they have mentors for me too, higher up who've done this before in different ways.
Thanks. So don't forget to complete the attendance form at least one time today. Amanda just sent it out to everyone. Thank you. Is there anything else? Any thoughts? Maybe not a question, but a thought about something that you heard?
I know, no video or no questions. Just please say you're there. So have you all thought about leadership in healthcare? Did you ever feel, that's a good question. Did you ever feel discouraged in college? Uh, yes, because I think sometimes courses feel really hard and it doesn't feel worth it because some of those courses that they require you to do, and you don't need to know all the details. Like there's thing called organic chemistry. I don't know if you have ever heard of it. It is hard and you're like, why am I doing this? Because all I want to do is like care for patients and it's like so far away from that. But it's like so important to keep reminding yourself why you're getting into it because so much of the healthcare process, you're doing things that it's like I still feel like are not useful for the actual core work of healing people. And again, that's why I think like no matter what your grade, you're like there's going to be so many exams you do, like don't get discouraged because more and more, like I was part of our residency like admission committee too. Like we know like how unjust our systems are and more like that is not the only thing we're looking at. Like grades, scores, like, yes, those are all important because we want you to learn some foundational thing because you'll need to know some medicine to take care of people. But we also know like we can support people to get there. And so much of the work that I do daily, like seeing patients, like it doesn't matter like what I learned in chemistry like 3 years ago. Like it matters like if I listen to them, if I understand where they're coming from, and it like if it's a Black trans female, right? Like there's only so much I can understand about their life. So it matters like there are more Black people in medicine, like period. Like all I can only go so far. So like having the diversity and representation so people can truly listen and then try to get them whatever like healthcare we can, understanding like so much of health is more than healthcare. And again, I like work in a system where they just give us so many guidelines and they try to make it easy. Like if somebody has high blood pressure, you do this and this and this. And that's not something like actually learned in college or in medical school because like healthcare is always changing and the organizations you are part of will help you through that too. So it's okay to get discouraged, but lean on others for support and remind yourself why you're doing it. No, that's always a good question. Because I believed, I think family medicine for me was primarily because of primary care. Because I wanted to just, when I thought about a doctor, I thought about primary care because it just means that I have this longitudinal relationship with a lot of people that sometimes specialists don't get. And when you're in specialty, like if I send somebody to cardiology, and I like all the cardiologists here, like all they talk about is the heart, right? And sometimes that's really important. I need their help. But I get to see whole families and I get to see kids and I get to see people like when they first come to me for help. And when the specialist can't figure something out, they actually send it back to me saying, well, everything seems okay. I'm not sure what's going on. And I have to like really provide that empathy and hope for them to like being like, it's going to be okay. We're going to make it through this. Because sometimes like, yes, it's like 2021 and there's so much in healthcare where I've like learned, but there's so much more to learn and people have things that we still don't know what's happening and all we can do is be with them and support them through it.
Well, thank you, everyone. I think we're at time. Make sure to fill out that attendance form. Dr. Sundar, thank you so much. This was amazing. I want to go back to school and be a doctor now.
Yes.
I think Amanda's going with me. I hope one of you that are not showing your faces join us.
Yes. Yeah. And I'm happy to help in any other way. I don't know who coordinates it, so just let me know. Or if you have any other questions later too, I think Corey has my information too, so you can always ask me.
Okay. Thank you, everyone. Have a good evening.